To increase your knee flexion, place both feet against a wall, keeping an 80 to 60 degree angle with your body. Slowly bend your injured knee by allowing the gravity to bring your heel down while keeping the non-injured leg straight. Start within pain-free ranges only and progress gradually. Start by lying down, placing the heel of your injured leg on a foam roller while bending your opposite knee slightly. Place a weight above your knee to increase the load. You can use books, dumbbells, plates, or anything heavy as long as it's comfortable. Begin by lying down on your back while keeping your injured leg straight and bend the non-injured leg. Slowly slide the heel towards your glutes by activating your hamstrings first. Start within pain-free ranges and increase gradually. To increase knee flexion, lie down on your stomach and wrap slightly above the ankle of your injured leg. Pull the band to help bend your injured knee. Make sure to bend the knee first before pulling the band. Start within pain-free ranges only and increase gradually. Keep your body straight and don't lift your leg. Start in a long sitting position with both legs extended. Slightly bend your injured leg first before squeezing. Squeeze your thigh muscles by pushing your injured knee down towards the floor. Hold the squeeze for 3 to 5 seconds. Lie on your back and wrap the pull-up band on your injured leg slightly above your ankle. Slowly slide your heel first before pulling the band towards your body. Hold stretch position for 2 to 3 seconds before bringing your leg down slowly. Place a foam roller or a pillow under your injured knee. Start with a 30 to 45 degree angle of knee flexion. Point toes up first and squeeze your thigh muscle before raising your lower leg. Make sure to feel your quads contracting. Hold for 2 to 3 seconds. You can use your elbow to lift your body to challenge the movement. Using your hands can also increase the difficulty. Lie on your back while bending your opposite knee. Spread both arms on the floor and straighten your injured leg. Bring your toes up and squeeze your thigh muscles by pushing your knee down. Maintain a straight knee as you lift your injured leg. You should feel your thigh muscles working. Slowly bring down your leg. Start with a comfortable range first and progress gradually. You can also use your elbow as a support to challenge the movement. Lie on your back with both arms and legs extended on the floor or bed. Bend both knees at a 30 degree angle and use both heels to lift your lower for 3 to 5 seconds. You can spread your arms on the floor. Lie down on your stomach and place a resistance band on both legs slightly above your ankles. Push the non-injured foot towards the floor. As you bring your injured foot towards your body, start with 0 to 30 degrees of flexion, first holding for 5 to 8 seconds. Make sure to keep both knees and thigh on the floor or bed all throughout the movement. Lie down on your back and bend your knees in a 90 degree angle. Place a resistance band slightly above your kneecap. You can also spread your arms on the floor or bed. Avoid arching your back by squeezing your core first. Make sure the band is taut all throughout the movement. Slowly bring your knees out, holding the position for 5 seconds.